Well, thank you so much for joining us, everyone. Again, this is Promoting Attendance Early, Absenteeism in Kindergarten and the Early Grades. And today we wanted to delve a little bit more into the root causes underlying kindergarten absenteeism. Last week, we talked a lot about the reasons why kindergarten chronic absenteeism is important. And today, we wanted to talk about that issue in a larger context and begin to understand how this issue has emerged. Before we get into all of that, though, we wanted to do some introductions. My name is Tanika Reed, and along with my colleague today, Tori Martin, the two of us have coordinated this learning series. We'd also like to thank the Department of Education staff who make this series possible, including Dr. Tracy Scott, Brian Culhane, and Liz Lembo, as well as the joint leadership of Dr. Jarl Crocker and Sarah Fizell of the Student Engagement and Attendance Center. Today, we are also honored to be joined by various staff from Attendance Works. Our presenters today will be Hedy Chang and Cecilia Long of Attendance Works, who will share information about root cause analysis and its relevance to kindergarten chronic absenteeism before we go into our breakout room session today. So, as we know, this session is all about kindergarten chronic absenteeism shaped in response to our SEAC audience. And today, we really wanted to focus our session on understanding the root causes of kindergarten chronic absence and the disparities and equity issues that underlie kindergarten chronic absence. So, last week, we discussed that overall landscape of why this is important. Today, we'll use tools like root cause analysis to identify factors behind kindergarten chronic absence. And also, we want to amplify special considerations for special populations of kindergarten learners. And please do not forget, tomorrow or next week will be our third session of this series, where we'll hear from a variety of different perspectives about how you can approach this issue and what actionable next steps you can take before August in order to address kindergarten chronic absence in your own communities. So during today's session, again, we'll start out with unpacking a little bit about why kindergartners miss school, jumping into those breakout rooms in order to talk about your own experiences with root cause analysis, as well as the causes underlying kindergarten chronic absence, and then talk a bit about those special populations that are most chronically absent and need additional resources in order to turn the curve on this issue. So, without further ado, we are now pleased to introduce Hedy Chang and Cecilia Long of Attendance Works, who will discuss root cause analysis and how it relates to the chronic absenteeism issue in kindergarten. Hedy and
Thank you.
Cecilia, thank you so much.
Thank you, Taniko. It's fabulous to be here and to see such participation in today's webinar, because addressing what's happening with our youngest learners is more essential than ever. We're going to start. So the focus of our topic is unpacking why kindergartens miss school. And I want to go to the next slide, because I want to just take a moment to talk about what do we mean by a root cause analysis. A root cause analysis is really, the purpose is to make sure that if we're going to come up with a solution or design an intervention, we're actually looking at the root of an issue and not just a presenting symptom. So let me give you an example. And this is actually a bit of a true story. I was working with a district, and a principal was frustrated because a parent that he had been trying to reach out with just was not responding to him. Affect was low, just couldn't get a response. And his frustration, he's like, doesn't she care? Doesn't she care about her kids? And when I heard him speak, I said, I wonder if she might be suffering from depression. And he stepped back and thought about it. And he actually really realized, for this mom who faced a lot of challenges, struggling with poverty, she really was dealing with challenges of depression. And I think about this too, like even when my kids were little, I think there were moments when I was feeling maternally depressed, and I didn't even have the same kind of resource challenges that so many moms today have. But if your assumption is that a mom doesn't care, is your analysis of the problem, which is only the tip of the iceberg, that low affect, the not taking kids to school. But really the issue is that A mom might be suffering from depression or feeling helpless. Your solution, though, has to understand and address that root cause. So, and then if you see that this is actually a challenge facing a number of parents who you're working with, then we need programmatic and systematic solutions that really focus on what will help families to not feel so isolated, not feel so depressed, and feel like they can take their kid to school, because ultimately taking a kid to school is a reflection that you have hope in a future and you believe in a future, and that you feel like you can make a difference in your kid's future. So again, when we just focus on the symptoms, we can come up with the wrong solutions. A root cause is understanding, unpacking patterns, system structures, mental models that allow us to come up with better solutions. Next slide. And many of you might have seen this before, but we know this isn't just true for kindergartners, but kindergartners as well as everyone else. If we want to come up with solutions, we got to understand what's causing kids to miss too much school. Is it about barriers, trauma, poor transportation, this, the lack of predictable schedules, lack of access to technology, which doesn't allow them to be engaged? Is it about aversion? And we see more and more challenges with anxiety. We're anxious, our kids get anxious. Is it about challenges with peers and how kids can really connect to each other? Is it about disengagement? One of the challenges I worry about right now is sometimes families aren't connected to schools. Families haven't been in early preschool experiences. Families haven't had a chance to see what's happening in school, so they may not really feel connected and engaged and understand what kids are learning. And then there's misconceptions where families might not understand what kids are learning so that they know showing up to school every single day matters, or maybe they're assuming that their students must stay home for any symptom of illness when things have actually changed. Unpacking what that is and how that may vary for different groups of students is really essential to knowing how we need to respond, who we need to partner with in order to improve attendance. And if you go to the next slide, we see these one question you might want to ask yourself is, do the high levels of absenteeism actually reflect an erosion in the positive conditions for learning that really help motivate kindergartners and their families to make sure that they're in school every day, knowing that school is physically, emotionally healthy and safe, feeling that school creates that sense of belonging, connection, support, academic challenge and engagement. And there's the investment in the well-being of staff and kids so that when kids and families walk into school, that relationship that's so critical to this happens. So if you go to the next slide, I want to suggest a few steps for how you can conduct root cause. One thing that you might do it for states, or if you're working at a community level, you can do it for your community. Your step one is to find out who are groups of kindergartners that you're concerned about. This is looking for sort of demographic groups. And then you want to look at that data to kind of understand, well, what's been happening with that? And you can use chronic absence data. Has the data changed over time? When you unpack that data, like if you're at a state level, you might notice certain districts are more affected, maybe rural versus urban, maybe different things that might affect that group of concern. And then if you're a state, you can help districts. And if you're a district, you can help schools learn about those populations. You can make sure they have tools and resources so they can partner with the kids, families, community partners to unpack and identify both the possible causes, but given those causes, what might be possible solutions. And sometimes you can even use additional data, whether that's health-related data, transportation data, to understand what might be some of the challenges that kids and families are facing. You can also take a moment to find those places that are positive outliers, the places that are getting better kindergarten attendance and lower levels of chronic absenteeism, so that you can then figure out what they're doing and seeing if they have replicable strategies that others can use. So I'm going to use my own state where I live as an example. If you go to the next slide. And I know some of you might have shown up to the last webinar where I talked about this, but I'm just using this to illustrate it. So in California, and if everyone could mute, that would be great. In California, when you look at your data, there's two kinds of ways of looking for those populations of concern. I see there are certain groups that are disproportionately affected: African American, Native American, Pacific Islander, Hispanic, Latino kids. So in terms of who's disproportionately affected, that's an issue of concern. But then I also notice in California that nearly 2/3 of the chronically absent kindergartners are Latino. So they're both disproportionately affected, and they make up a large portion of our kids. By the way, there are still a large number of white kids who are chronically absent. So depending on where your community is, that might help you think about whose perspectives do I really want to hear from more, understand more, so I can figure out what are the issues that are causing this increase in kindergarten absenteeism and what might be the solutions. And then the next slide is another way of cutting the data. And that's looking at different kinds of populations. So English language learners or kids with disabilities, or we can see that almost 2/3 of the kids who are chronically absent are actually socioeconomically disadvantaged. So we know that poverty is very much connected to what's driving this for large groups of kids. And you might want to understand what's happening for kids who are more affluent versus kids who are struggling with poverty differently, because their causes, while they might fall into those 4 buckets that I talked about earlier, might actually vary, and solutions might vary. Next slide. And this is an example of I'm going to take English language learners and looking at this over time. So what you can see from this is prior to the pandemic, English language learners actually showed up to school a little bit more than their typical peer. Past 21, 22, you're starting to see English language, they more than tripled. So huge increases of English language learners, and it's even a little bit higher than their average pair. And while that's not a huge percentage, California is a pretty huge state, so that's still a lot of kids. I'm now going to turn it over to Cecilia and have her talk about some strategies and tools for how you unpack what's happening.
Thanks, Hetty, for sharing those numbers and that approach to looking at chronic absence and root cause. So I do want to say that there are so many of you in the audience that I know and have worked with, that there's a wealth of knowledge and information out there. So I know in some ways I'm preaching to the choir, but I want to encourage us all to use the tools that we have, like fishbone diagrams and other pieces, in order to understand what's behind the numbers. For example, that shift Hetty talked about. And the reason we're doing this focus is we've seen the dangers of making assumptions about families. We hear often when we're in schools and districts, those beliefs that are not based on any sort of evidence about what families are doing and why students are absent. So we need that. We also need to beware of listening only to people who are like us, rather than those who are closest to the problem and closest to the solutions, by which I mean the families, students, and staff who work directly at that level. And that's a particular danger for us who tend to work at the higher levels of state or regional. So root cause analysis, fishbone diagram is a great tool to use with a diverse group to understand what are the causes of a current problem. And it helps us visualize and look very specifically at how a problem might be addressed. So next slide. This is an example where we go back to what Hetty was talking about. When we see 43% of English learners, for example, chronically absent, that's our problem statement at the head of the fish. And what you want to do with various interest holders and various groups is to begin brainstorming and then grouping the reasons or the bones of the fish behind the absences. So we've done this. This is a real life example. Anonymous, where you begin to see some of the bones or the root causes are grouped around things that are really things that are within or about the students and families, right? So the first one on the top, communication. Maybe the students are missing because they're not getting the information and expectations in their home languages or can't communicate, right? So that's one piece. Perhaps it's something about the student, that there's something going on in their family life, or they have an undiagnosed disability. So that's leading you to a different set of solutions to support students. Then we get at some of those pieces underneath the iceberg that Hetty talked about, that you really need to look at some of the systems pieces. Perhaps we only offer half-day kindergarten, and if we offered full day, that affects the attendance. So looking at those pieces really helps us begin to pull apart those big reasons, those big buckets, and it leads down different paths to solutions. So I don't want to go on too much longer because we want to give you a chance to talk in small groups. So I'm going to conclude on the next slide with some resources that you may also want to consider in addition to Fishbone. Many of you work in continuous improvement, continuous quality improvement, so you know about empathy interviews. But I also want to highlight a few resources we have on the Attendance Works website that you might want to consider in exploring root cause, like the SEAT, or 2x10s, or attendance cafes. So those are just some examples and resources for you. I'm going to turn to Nico because he has even more to share with you before we go to small group. To Nico.
Thank you so much, Cecilia. That is entirely correct. We do have a lot of resources on this information, all of which, again, as Jarl has mentioned, will be both shared in the chat and also in the follow-up email that you will receive for this session. We encourage you, pick one that kind of speaks to you and look through it a little bit. But again, you'll have access to all of these later. All right, so in this next part of our presentation, we did want to move into a breakout room discussion. And I think a major part of the reason why we decided to do this is in response to what Cecilia was saying. Think tools like root cause analysis are really powerful. However, a lot of the feedback that we received from you guys, our audience members, is that it's challenging to engage in processes like this because it's challenging for you to identify who is at the table and who is not. In order to do this, we wanted to give our participants today the space and the opportunity to have a discussion about what resources you have to do root cause analysis and what processes and structures do you have to help both your SEAs, your schools, and your districts engage in this type of thinking. So we're going to drop into breakout rooms in just a second, but we wanted you to walk through these questions along with any reactions that you've had to the series overall. In doing this, we hope that you'll be able to take away the resources and the next steps that you need in order to actualize this in your own community and see root cause analysis in action. Okay, so without further ado, Tori, I think we're ready to open up the breakout rooms.
Yes. As we've discussed, root cause analysis helps us identify the needs of the families we serve. How we connect with different unique populations and identify their needs and potential barriers to attendance is a large and important conversation to have. To place this in an equity perspective, it's important to talk specifically about key underserved populations and how we serve and support these students and families. The first special population we'll discuss in this section of the presentation is English learners. English learners are one of the fastest growing populations in the US, and in the fall of 2020, more than 5 million English learners were enrolled in public schools, representing 10% of the total K-12 enrollment, and that number is growing. Of those 5 million English learners, more than 3/4 spoke Spanish at home, the most commonly reported home language of EL public school students by far. The next most common languages of ELs are Arabic, Chinese, and Vietnamese, although each of these populations made up only under 3% of EL enrollment each. There's also a significant overlap between the EL population and students with disabilities. 16.1 of the total EL enrollment were identified as students with disabilities. In comparison, students with disabilities made up 14.5% of total public school enrollment in the 2020-2021 school year. To put this in the kindergarten and early grades perspective, also in fall of 2020, 12.9% of public school kindergartners were English learners, higher than the 10% that English learners make up of the total student enrollment. Attendance rates since the onset of the pandemic have declined significantly for ELs, which could be for a variety of reasons, which we saw in attendance work sample fishbone diagram. Some of these reasons may include the impact of COVID-19 on these families specifically, many of whom may be immigrants, the language communication barrier between families and school staff, or a lack of targeted outreach by schools to these families. The root causes we touched on in the last slide, of which there are many more, we only named a potential few, are important to consider when thinking about engagement strategies as well. We wanted to discuss targeted strategies for specific populations because strategies used to reduce chronic absence in one population will differ from the strategies used to target a different population and will vary based on root causes identified. For English learners specifically, prioritizing making students and families feel welcome is crucial to children coming to school. Acknowledging that students who come to school with a language other than English also come with many assets, language, culture, and funds of knowledge. The existence of school programs serving ELs is a great step towards engagement, but first comes ensuring students and families are aware of and can access these programs and feel comfortable joining. Methods of doing so include providing space and time for families to build relationships with staff, community members, and school partners, hiring staff that represent the EL community, can speak the language, and relate to cultures and experiences of students and families joining the program. Also sharing information about these programs and attendance in general to families in their preferred languages and communication methods. And one last engagement strategy to highlight is directly engaging in discourse with these families and community partners once relationships are built to identify and problem solve barriers they may be facing outside of school. This is part of the root cause analysis framework we focused on during this session and will help tailor further engagement strategies to the EL population. Before we move on to highlight another special population, this slide from the Office of English Language Acquisition provides some additional resources to engage with English learners and their families. We have placed in the chat the link to an English Learner Family Toolkit, which was designed to help educators create a welcoming environment and build relationships with EL families, communicate effectively with EL families, and overcome barriers to EL family engagement. In addition to the EL Family Toolkit, there are also other family engagement resources available from OELA, including a fact sheet on family school engagement, and then both the English Learner Toolkit and the newly updated Newcomer Toolkit each have a chapter devoted to the topic of family engagement. There is also a webinar and a podcast on the topic of family engagement, and these resources can be accessed on the National Clearinghouse for English Language Acquisition website. Link is in the chat, and that will be all under the resources tab. And as we've stated earlier in the presentation, these resources will also be sent out in the days following this session. So our next special population we wanted to cover is students with disabilities. The Individuals with Disabilities Education Act provides services and supports to a child with a disability who is found eligible under the IDEA. To give a few examples, this can include students with specific learning disabilities such as dyslexia, students with chronic or acute health problems, or students with autism spectrum disorder, among many others. During the 2022-2023 school year, there were over 7.5 million children aged 3 to 21 served by IDEA, to give you an idea of the size of this population. These students are 1.5 times more likely to be chronically absent than students without disabilities. And this can be, again, for a variety of reasons or root causes, including chronic health conditions, inappropriate or inadequate special education services at school, or struggles with mental health, anxiety around attending school, for example, due to bullying or harassment. Again, among other reasons, there are a few resources relevant to the slide that are also being dropped into the chat. Engagement strategies pertaining directly to students with disabilities include improving the collection, reporting, and analysis of data based on disability status in order to make programmatic improvements. So this relates back to our focus in session 1 on the importance of stratified data collection and using it to build capacity and increase knowledge to support solutions. Strengthening connection networks between preschool and traditional networks to support the IEP transfer across schools. So this relates specifically to these early grades where students might be moving to a new school from preschool into kindergarten, and that brings new challenges and the need to bring or build new relationships that ensure success for a student with disability. Prioritizing addressing special educator shortages that may cause a higher student to teacher ratio that also may decrease the quality of special education services in schools. Recommending that schools consider the need for an IEP meeting when absences are clearly connected to the student's disability. So districts can provide information for schools and school staff that encourages them to act quickly, to address attendance issues with parents, and to convene an IEP meeting to amend the IEP to add or revise attendance information. Chronic health conditions that interfere with school attendance should also be well documented in the student's IEP. Documentation should include how the student will be provided with these services during periods of extended absence. And then lastly, providing guidance, oversight, and professional development opportunities for school and district staff. So this could be focused on sharing about potential root causes of chronic absence for students with disabilities, or the professional development could include an explanation of IEDEA's federal regulations that require that a district revise a student's IEP to address any lack of expected progress towards the annual goals. As we said, and is obvious here, engagement strategies are going to be tailored differently for different populations who have different root causes for not consistently attending school. And the last special population we wanted to cover today is students new to traditional schooling, which is a crucial population to engage in this early learning context. This relates back to our discussion and emphasis on the kindergarten transition that we discussed during session 1 last week. Over 50% of preschool age kids in the US are not currently in school. High quality early childhood education is often inaccessible to many Americans, especially low income students and children of color. And the kids who can benefit the most from these early learning programs are already the least likely to access such programs. Early childhood education, as we've discussed, improves school readiness, and students who enter kindergarten behind their peers may struggle for years to catch up. When parents do seek to utilize childcare or preschool, they often struggle to find high quality, affordable, and available options. And contributing to this challenge is the fact that very few states offer free public preschool programs starting at age 3. America's childcare system is also chronically underfunded, and this issue is exacerbated by widespread staffing shortages in the early childhood education field. And also the share of kids missing out on preschool varies widely across states. We also wanted to highlight here that supporting access to high quality preschool is one of the Department of Education's priorities, which we heard about from the department's Deputy Assistant Secretary, Swati Adarkar, in session 1. Students and families without preschool experience may be more likely to be more chronically absent in kindergarten, although data collected on this population is not largely available. Reasons for chronic absence in this population may include heightened health and safety concerns from parents, kindergarten registration requirements, including vaccines, and parents of children brand new to the school environment have yet to establish a relationship with the K-12 system and establish that routine of daily attendance for their children. And strategies to engage this population specifically include conducting outreach to families early and in a variety of contexts regarding school registration and related requirements. Again, that includes vaccinations. And the importance of expectations of kindergarten attendance generally. Coordinating summer bridge programs for students who did not participate in formal preschool programs, And then also creating ready schools by implementing and maintaining focused transition strategies and effective and welcoming outreach with families and parents that continues to build that partnership for everyday school attendance and partnering together to support student progress. This may include sending a welcome letter in appropriate languages and inviting families and students to visit classrooms and meet teachers prior to the first day of school. And I think there's another resource here being dropped in the chat, but Swati also shared some resources related to the kindergarten transition last week. So look for those in the resources from the thank you email from session 1. Overall, our goal with this section of the presentation was to highlight a few populations within early grades who have different needs that have to be met in order to promote early grade attendance. We wanted to expand on the root cause discussion and begin to transition into a conversation around tailored actionable strategies, which will be the focus of next week's session. And so on that note, we will transition into the wrap up and next steps. So next week, please join us for the final session of this series, session 3, where we will hear from a panel of federal, state, and local stakeholders and partners to hear their strategies and actionable steps on kindergarten chronic absence. This will be the final session in this learning series. This session will be centered around a panel discussion and audience Q&A. Panel members also come from a variety of organizations and perspectives, including CDC RISE, Families in Schools, Read On Arizona, and Kids in Transition to School. The panel will be moderated by Swati Adarkar of the Department of Education, who we heard from in session 1. And this link to the feedback form is being dropped in the chat as well. There's also a QR code on the screen that you can use. We want to ensure that these sessions are meeting your needs. With that in mind, please scan this feedback form. We would love to hear your feedback, anything you have to share related to this session and this series as a whole. Thank you so much again for participating. We sincerely appreciate you taking the time to talk with us and peers during our session today. As a follow-up, we will email a copy of the final slides and resources. And if you are interested in sessions with the center and SMEs on a particular topic, you can email Taniko Reed or Tori Martin, whose contact information is on the slide here. You can also email the SEACenter@westat.com. And we will drop the link to the SEAC website in the chat. There's also, again, a QR code here on the screen if you want to learn more about the work that we do as SEAC or to find additional TA resources. Those will all be on the SEAC website. Thank you so much, and we look forward to seeing you next Wednesday.